It's another time to get enlightened today on Be Brave to Survive. Now, we talked about lymphoma some weeks ago, and today we shall be looking at another type of blood cancer known as leukemia. Alright, now if you have not subscribed to our channel, just do so by clicking on the button down here. Do us a favor by sharing this video with everyone, because knowledge is the power for awareness. Leukemia is a cancer of the blood and the bone marrow. In simple terms, cancer is the uncontrolled growth of abnormal cells. Cancer can develop in anywhere in the body. Unlike other cancers, leukemia generally does not form a mass or a tumor. It doesn't form a tumor that can be felt or seen using imaging such as X-rays. There are many types of leukemia. Some are common in children and others are common in adults. Leukemia involves the white blood cells, which are strong infection fighters in the blood. Now, I hope you remember when we talked about lymphoma. Okay, if you don't remember, you can check the link here to know more about lymphoma. Now, cells normally grow and divide in an orderly manner as the body needs them to. But in people with leukemia, the bone marrow produces abnormal white blood cells which do not function properly. Treatment for leukemia can be very complex depending on the type of leukemia. But there are strategies and resources that makes treatment successful. These strategies include collaborating with medical professionals who work as multidisciplinary team to provide wholesome care for people with leukemia. 2, ensuring that the medical specialist team have the required experience in the treatment of leukemia. These are strategies you should look at. Make sure that the specialist expertise have been tested and trusted in the field of oncology. And 4, believe in God, because God finally heals. Now, scientists do not understand the exact cause for leukemia, but they believe that it develops from a combination of genetics and environmental factors. Looking at the factors that may increase the risk of developing some type of leukemia, it includes previous cancer treatments, genetic disorders, exposure to chemicals like benzene, smoking. Remember, we talked about the dangers of smoking. The link is also here. You can also check that video out. And finally, a family history for leukemia. However, most people with known risk factors may not get leukemia, and people with leukemia may not also have these risk factors. So you gotta be vigilant, and you have to be able to look at the individual situations. Leukemia symptoms varies depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue or weakness, frequent or severe infection, losing weight without trying, swollen lymph nodes, we've talked about this, enlarged liver or spleen, easy bleeding or bruising, recurrent bleeding from the nose. Of course, we have the presence of tiny red spots in the skin, excessive sweating, especially at night, and finally, bone pain or tenderness. Some treatment methods for leukemia include simple cancer treatments like chemotherapy, targeted therapy, interferon therapy, radiation therapy, surgery, and the stem cell transplantation, which is gaining awareness right now. We'll talk about that in subsequent videos. Now, it is very important to make an appointment with a doctor if you have any persistent signs or symptoms that worry you. Leukemia symptoms are often vague and not specific. You may overlook early leukemia symptoms because they may resemble symptoms like the flu or other common kinds of illnesses. So it is very important for you to stay vigilant on any sign that you notice in your body's normal functional system. We want to especially thank you for watching Be Brave to Survive on YouTube. Now, if you want to keep up to date with the videos we are putting out, click the subscribe link just right below me and turn on the bell notification to get notified when we post a new video. So thank you for watching.